Okay, good afternoon, everyone. My name is Tiziana Oliva, and I work for Leonard, Cheshire. And I want to thank everyone for joining us today and for taking the time to participate in the session. So I'm going to start with a few housekeeping information. So sign language interpretation and captioning is available. Captioning link is in the chat box, and the sign language interpreter is on the screen. All attendees are muted so that we save on background noise. However, you can still ask questions. For technical issues, if you have any, use the chat box. And for content questions, use a question box. You can start sending questions at any time in the session, and we will aim to answer all of them. If not within the session, then later on via email. Accessible recording of the session and the transcript will also be available later, and we will share a link. Also, I'd like to thank in advance our interpreters and captioner today, Lisa, Gerdinand, and Evan, for helping us with the session. And also, everyone, do not forget to tweet. Hashtags and relevant references are going to be shown on the screen. So again, thanks for joining us today. And today our session is on disability data in crisis response. So why is that important? Well, as we enter the last decade for the delivery of the Sustainable Development Goals, the COVID-19 pandemic has threatened to set back progress, and particularly for the most marginalized groups, including persons with disabilities. Now, we know that COVID-19 doesn't discriminate. However, we also know that pandemics and crises affect different groups in different ways. And there is a disproportionate effect on certain groups and communities who can become even more marginalized while their rights are being put at risk. Persons with disabilities, we know, are among the hardest hit. And it is clear that progress on the SDGs will falter if the COVID-19 response and recovery is not inclusive. So in order for response and recovery to be effective, it is necessary that the populations most at risk are included in the process, and that their needs are being met. So high quality, accessible, and timely disaggregated data is critical. It's critical to generate crucial information for decision making and for resource allocation. So this need has actually long been recognized in the SDG framework, and it has become even more pressing during the COVID-19 crisis. So today in the session, we will be exploring the commitments that governments and donors, UN agencies, and other actors have made towards disaggregated disability data, as well as its application during the crisis to ensure that persons with disabilities were not left behind. We will also explore the work supported by the Innovation to Inclusion program to make high quality data available to assess the impact of COVID-19 on persons with disabilities. And data has been collected in Kenya and Bangladesh to understand the economic impact of the crisis and inform response and recovery measures relating to employment and social protection. So the I2I consortium partners have worked very closely with DPOs to design, collect, and analyze the data, which is part of a data-driven advocacy tool called Inclusion Counts. And if you look in your handouts on the screen, you'll also be able to download the results of the surveys and the analysis of it. So we're very pleased today to host our eminent panelists from the UK Department for International Development, the Kenyan and Bangladeshi governments, civil society representatives, including DPOs, as well as the International Labour Organization. So our panelists will be highlighting some of the key initiatives taken towards data collection and disaggregation, and we want to thank them for taking the time to share their thinking and their work with us. And so I will introduce our speakers who will each address some of the key elements related to the topic, and we will then follow up with a question and answer session. So I just want to remind everyone that we only have an hour and we will have to stick to an hour, which is very tight. So I'm asking the speakers to please stick to the time that we have allocated to each of you just to share your thoughts. So it's 4 minutes each. And I'll be really grateful if you help me to keep time, but I may also have to flag or intervene if you overrun, I'm afraid. So I apologize in advance for that. So without further ado, let me start with introducing the first speaker, Neil Jackson, the Chief Statistician from the UK Department for International Development, who today will talk to us about some of the key UK government initiatives on data collection and disaggregation, and the commitment made to ensure that every person counts and will be counted. So Neil, over to you.
Thank you very much, Tiziana. It's a pleasure to be here, and thank you for inviting me onto this panel discussion for this very important topic. So it's a real pleasure. So coronavirus is the biggest threat that my country has faced in a generation, and we are not alone. All over the world, we are seeing the devastating impact of this invisible killer. We in the UK have so far pledged up to £764 million of UK aid, and we're working closely with others at the forefront of the global response. We know that people with disabilities, people with pre-existing conditions, and those with complex needs are disproportionately impacted by the coronavirus and are at more serious risk of severe complications and fatality, as well as the secondary social impacts of COVID-19. DFID is working to ensure all of our responses include people with disabilities and other marginalised groups in order to leave no one behind. We're engaging internationally to push for greater explicit consideration of and support to people with disabilities and older people across the COVID-19 response. We expect all humanitarian partners to adhere to the Interagency Standing Committee guidelines on inclusion of persons with disabilities in humanitarian action. The new funding we are providing through the Rapid Response Facility will support vulnerable groups. DFID will strive to ensure all COVID-19 containment and mitigation activities are fully inclusive of and accessible to older people, people with disabilities and pre-existing conditions, and those with complex needs. DFID's programmes are also pivoting to respond to COVID-19. Our flagship Disability Inclusive Development Programme will fund adapted and new interventions to produce evidence about effective ways of ensuring people with disabilities are not left out of humanitarian and health responses. We recognise that we need data to do this properly. Inclusive data is essential in planning and implementing DFID's COVID-19 response and recovery, as aggregated data will hide differences in exposure and impact of the coronavirus between population groups. Disaggregating all data for the pandemic as far as possible by sex, age, disability status is vital for understanding differences in exposure, treatment, and impact. We developed guidance on how disaggregated data can be used to monitor the impact of our bilateral programme's response to the COVID-19 pandemic. DFID was one of the early adopters of the Inclusive Data Charter. We published a draft Inclusive Data Charter action plan at the Global Disability Summit in 2018, setting out how DFID will put into action the 5 data principles outlined in the Charter, vision and principles. Our disability-specific commitments in the action plan include continuing to advocate for and support the use of the Washington Group Disability Status Question Sets for disaggregation, especially where we support national censuses, surveys, and administrative systems. Going beyond disaggregation to collect further relevant data for disability inclusion, such as enablers and barriers to inclusion. And working with others to test the feasibility of using the Washington Group questions for disability status in administrative systems and programme M&E processes. DFID has invested £45.8 million to support the World Bank Trust Fund for Statistical Capacity Building, a multi-donor fund established to strengthen the capacity of statistical systems in developing countries to produce and use statistics to support effective decision-making for development. The programme is nearing completion, but one of its final activities has been a call for bank-executed proposals to address urgent data needs related to COVID-19 in areas of crisis impact monitoring and mitigation by supporting activities that lead to the improved availability, quality, and use of data by countries in response to COVID-19. DFID is also supporting the Global Partnership for Sustainable Development Data to ensure that governments, UN agencies, development partners, and civil society organisations have the data they need to fight the pandemic. GPSDD are helping countries to make better use of administrative data, such as tax information, birth and death registrations, to address the COVID-19 situation. And finally, DFID is also partnering with the UK Office for National Statistics to improve the quality and availability of data to support SDGs and ensure no one was left behind. This programme focuses on Kenya, Ghana, Rwanda, and Jordan, and also the UN Economic Commission for Africa. Thank you very much.
Thank you very much, Anil, for your contribution. I'm moving on to the next speaker, and I'm introducing Dr. Ashrafi Ahmed, Project Director of the Disability Detection Survey Project and Joint Secretary for the Ministry of Social Welfare in Bangladesh, who will share information on the Government of Bangladesh commitment to disability disaggregated data. Dr. Ahmed, go ahead. Thank you.
Good evening from Bangladesh. I'm so delighted and honored to be here with all learned panelists. Well, Bangladesh is a land of resilient people, and we have done remarkably well regarding achieving the MDGs, and now we are on the path of the SDGs. And the very essence of SDG is inclusion. And although COVID has come as a big blow to us, we cannot deviate from our path of development. And still many people are stigmatized and marginalized due to their age, sex, ethnicity, or disability. We are aware of that. And since assuming office, our Prime Minister Sheikh Hasina and her daughter, Ms. Saima Watad Hossain, they have been working relentlessly to bring all the marginalized people in the mainstream of development. And we have enacted 2 laws. One is the law on the rights and protection of persons with disability, and another one is the Neurodevelopmental Disability Trust Act. So in the backdrop of these 2 laws, we have done a survey in 2013-14 financial year where our lowest tier government workers, union social workers, they went from door to door and collected data of 1.4 million people. And they were disaggregated by 12 categories, severity, and they were diagnosed by doctors assigned by the government. And then this data was enrolled into a database, and it is a longitudinal process, and still the registration process is going on. And every day, people can register at 570 units all over Bangladesh, and people can also register online. So we have now information stored in a database, and today we have 20 types of information from 1.9 million people. And we have distributed ID cards among them, and we have denoted them as golden citizens. And now insolvent allowances are being given to 1.7 million PWDs, and 100,000 are getting education stipends. For distributing relief, persons with ID cards are being prioritized during they are in the COVID crisis, and we have 103 help and service centers, including 35 mobile therapy vans. Also, job fairs are held every year, and government has ensured pension for the children of government service holders. And Bangladesh has also done extremely well in the digital platform for accessibility. Our ICT policy ensures accessibility in all spheres. We have almost 140 million mobile phone users, and there are the union digital centers who are helping the digitalization process. And we have 25,000 government websites which are accessible to persons with disabilities. We have Braille textbooks for blind children, and we have textbooks which is converted to digitally accessible information system, or DAISY. And the A2I, the Access to Information Authority, is always supporting every ministry to enable PWD's accessibility, and we are introducing e-learning platform. But at the same time, we have some challenges, like we have to ensure data availability, reliability, and how to share it within the ministry's divisions so that it can really help in the inclusive approach and the intervention process, and all the DPOs can be heard, and they can be also use it in their research and development. And we are lacking trained manpower at some cases, but thank you for your patient hearing.
Thank you very much, Dr. Ahmed. Really appreciated. I'm now moving on to the next presenter, and I want to introduce Salma Maboo, who is the founder and general secretary of Bangladesh Society for the Change and Advocacy Nexus, a women-led DPO, who will talk to us about how DPOs led a citizen-generated data collection process to bring out lived experiences during the crisis. Salma, please go ahead.
Thank you. Thank you for inviting me on behalf of DPO in this discussion. I will take this opportunity to thank government for continuing the disability identification survey, where a strong and earnest effort from Dr. Ashrafi Ahmed behind the work, which gave persons with disabilities to come out from social stigma and proudly identify themselves as a part of human diversity. As you know, we have done the survey under the I2I project to understand how people with disabilities are doing in this pandemic situation in Bangladesh. We have taken a telephonic interview of 135 persons with disabilities from 3 districts, where not only DPOs were involved, but also interviewers were persons with disabilities. We have taken the interviews of persons with visual, hearing, physical, cerebral palsy, intellectual, and mental health issue. Among them, 59 were women with disabilities. The analysis of the data was done by disaggregating according to disability, gender, and age, which improves our understanding of the impact and design interventions accordingly. Since the COVID-19 pandemic started, 18.5 of those surveyed are still able to work. 85% feel insecure in their current job situation, whether employed or self-employed. And there is a larger portion of people with disabilities in rural areas are affected by loss of livelihoods. You know that Bangladesh economy is heavily dependent on international trade such RMG. 4 million people are employed in this sector. Among them, 70% are female. Last few years, scope of employment in this sector for women with disabilities were increasing, but slowdown of global economy hampered the situation. Already some RMG industry have been partially cutting the staff line due to cancellation of orders from buyers, where women workers with disabilities will be in danger to lose their job. Also, lack of computer, the weak network of internet, and high price. It is difficult for low income persons with disabilities to continue their job through it from home. So we have some recommendations. People with disabilities and their families need targeted support around their income or loss of employment or business. Government should ensure benefits are accessible, and in some cases providing direct support for the relaunch of their businesses. There is a need for fully accessible communication to reach persons with disabilities with message about COVID-19, partially around employment. Measure to control the spread of the virus should be adopted, and contexts where ongoing support is needed to live safely and independently. Encourage flexible work arrangements for persons with disabilities, including the provision of assistive devices and other technology to enable home working. People with disabilities and DPOs should be included in decision-making, planning, implementation, and monitoring of national COVID-19 responses, and responses should be informed by high quality disaggregated data, which should be made available to policymakers and humanitarian responders. We hope that such platform help us to look back our works and focuses the new dimension to make real of our dreams. The dream of SDG, no one leave behind, will be achieved within 2030 with the participation of persons with disabilities alongside government in each and every works. Thank you again for giving me this opportunity. Long live persons with disabilities and long live the movement of persons with disabilities. Thank you.
Thank you very much. Thanks for the great contribution. Really useful recommendations. So, and now I'm going to move on to the next speaker. So I'd like to introduce Zachary Wangari, the Director General of the Kenya National Bureau of Statistics, who will share some insight into how Kenya has made welcome strides on data disaggregation. So Zachary, if you want to go ahead.
Thank you very much for inviting me to and being a member of the panel. I want to start by mentioning that Kenya successfully conducted its first digital population and housing census in August 2019, that is last year, and we did include a disability module using the Washington Group on disability statistics. And the inclusion of this set of questions has assisted in addressing data gaps on persons with disability and enhancement of data disaggregation for this segment of the population in line with the SDG principle of leaving no one behind. Issues of persons with disability in our country are very well articulated in our legal framework. Our constitution has a Bill of Rights, and we also have a Persons with Disability Act, which has established a National Council for Persons with Disability that handles issues pertaining to PWDs. The government also advocates for inclusiveness of PWDs in all aspects of development, and even they are given access to government procurement opportunities which are reserved for them. And this therefore calls for more disaggregated data that is critical for policymakers and also program implementers. Further, I want to state that the government committed itself to ensuring that we collect disaggregated data on persons with disability in national census and surveys as per the Global Disability Summit commitment of 2018. And we made a commitment at this summit, and we were able to achieve that. That demonstrates political will in terms of ensuring that we have disaggregated data. Again, a sign of commitment, the government was also able to fund the population and housing census, a very, very, very expensive undertaking at 99% funding. Again, a clear demonstration of government commitment, and that census we acknowledge included the module on disability with the Washington Group sets of questions. Again, we are also part of the international community, and we adhere to international standards, and there is consensus at the international statistical community on the inclusion of the Washington Group questions in censuses and also in surveys. So the government is committed to ensure that we collect disaggregated data on persons with disability. Again, in addition, mentioning about the census specifically estimated the number of PWDs, their distribution in the country, the types of disability, and other socioeconomic and demographic factors. And this aimed at getting up-to-date information on persons with disability for purposes of planning, monitoring, and evaluation of programs. The Bureau, we call ourselves the Kenya National Bureau of Statistics, can also leverage on the increased capacity in using the Washington Group questions to support surveys measuring socioeconomic impact of COVID on persons with disability. We are currently having surveys that we are doing to measure the socio-economic impact of this global pandemic. And in addition, what we are planning is to ensure that we include disability module in any socio-economic survey that we do, such as the labor force survey, to collect data on PWDs. And also we are planning to have a standalone disability survey that would also avail more detailed and disaggregated data for persons with disability. And how we do collaborate with stakeholders, the Bureau has already formed a disability technical working committee that has representation from data producers and users of official statistics from ministries, departments, and agencies, and also from non-state actors, including disability or disabled persons organizations. And this committee primarily was created to strengthen stakeholders' cooperation.
I'm sorry, Zachary, we ran out of time, so would you mind wrapping up?
Let me wait. And so we have these committees which have got all this close representation. And what we are also doing currently is that we are in the process now of undertaking in-depth analytical work to have an in-depth analysis report on the census data that we collected in 2019. Thank you very much.
Thank you very much for your contribution, really useful. We are now going to introduce the next speaker. We're pleased to introduce Jane Kihungi, the Executive Director of Women Challenge to Challenge, a Kenyan DPO, who will talk to us about how DPOs are advocating for inclusive COVID-19 responses. Jane, please go ahead.
Okay, thank you, Idia, for inviting me to be participant in this panel. Can you hear me?
We can hear you. We cannot see you, but we can hear you. There you go.
I'm sorry,
Jane.
Yes, you turn on the camera, but not the microphone. If you don't, oh, perfect. Thank you.
Okay, thank you. What I'm saying is that, as Zachary has said, the Kenya Census 2019 was able to collect data and disaggregate it on disability. And this is very important because it has given us the real situation of persons with disabilities, where it shows that we have limited access to education, access to information, access to health services, access to employment, and very few persons with disabilities are registered under social protection. So therefore, with the COVID-19 pandemic, which has brought a lot of challenges to the governments all over the world, people with disabilities have been affected differently. And because they have the needs that really needs to be considered, and to be able to bring out these needs with the project Eye to Eye that is undertaken by Leonard, Cheshire, and WCC is a partner to this, we conducted a survey in July 2019 just to bring out what are the challenges that persons with disabilities are undergoing. And if we really want to achieve SDG and claim that we are reaching out to everybody, then we have to disaggregate our data. And therefore, this report that was done July 2020 shows that 30% of persons with disabilities have no access or are unable to access information. So what does this mean? It means even when the government was issuing out protective protocols, many of us were unable to get this information. When the government of Kenya was expanding a safety net on cash transfer that is being given every week to persons with disabilities, a number of us did not apply. Why? because we did not get this information. Further, the report shows, now I'm talking about the survey that we have done in connection to COVID response, shows that 68% of persons with disabilities are not able to go to work. Either they cannot work anymore. Then further, 65% are very insecure of retaining their job. They are not sure whether they'll get back to work. And this also shows the number of women who participated and the number of men. And for sure, number of women are more, because it is at 49.7 are women who responded to the survey, while 45.8 are men with disabilities. So we really need to do more to be able to, as DPOs, to be able to advocate for the rights of persons with disabilities using the facts that have been collected and the data that we have been able to collect, so that we can be able to come up with affirmative actions that will be able to address the needs of persons with disability comprehensively. So what am I saying? It is very important to analyze and disseminate data so that we can understand the challenges that people with disabilities are going through, so that we can have their needs that are well articulated. For example, we need to ask ourselves, what happened when we are told to avoid the visitors during this period of COVID, keep social distance, and yet, or even we are told to keep the social distance, and yet a woman or a man with disability depends on others for support. We depend on people to give us support in our homes, at workplace, and all that. We are told to wash our hands every time we are going to places, and yet we support ourselves on everything that is around us to make our mobility stable.
Jane, I'm sorry, you have run out of time, so would you kindly wrap up? Thank you.
Sorry, Jane.
Jane, we can't see you anymore.
You just muted yourself again, if you don't mind. Perfect. Thank you.
I don't know what is. Sorry. I don't know what is happening to my cancer. It keeps on moving there, but I'm sure
we can see you perfectly now.
Yeah, if you can say 2 final words, because we ran out of time. I'm sorry.
My final words would be, together with the Leonard, Cheshire, and other DPOs, WCC will use this data to advocate for meaningful involvement of persons with disabilities in all programs, including emergency responses. We will engage more to ensure COVID responsive policies are all inclusive to be able to meet the needs of persons with disabilities and their caregivers. Thank you for this opportunity.
Thank you very much for your contribution. So I'm now going to introduce, last but certainly not least, Stephan Trammell, the Senior Disability Specialist of the ILO, who will talk to us about how we can foster a disability-inclusive socioeconomic response to the crisis, supported by governments, donors, and civil society. Stephan, over to you.
Thank you, Tiziana. Well, let me first explain what we mean by socioeconomic response. No, and I think the best way to do that is just to reflect the conversation I had this morning with colleagues from Uganda. And of course, in Uganda, persons with disabilities are concerned about being infected by the virus, but they are 3 times more concerned by the impact the economic crisis is having. They're much more concerned about dying from hunger, from not being able to eat, than from the virus. Now, the situation might vary from country to country, but I think in many countries, especially in countries where the social protection system is very weak, the main concern of people with disabilities is around the economic impact. And that is what we refer to when we speak about the socio-economic recovery. The plans that governments are starting to design and implement in terms of job promotion, in terms of social protection, etc. We just had a global summit in the ILO with a lot of global leaders, heads of states, around the impact of COVID-19 and the measures that they were taking to address the situation in the labor market. And unfortunately, we could see very, very little attention to persons with disabilities in these interventions. I think that is the big challenge that we have. We did a quick analysis. Many countries that are starting to design these socioeconomic responses, the first thing they do an assessment of the situation. Yeah. There are 40 countries that so far have done these assessments. They have been led by the United Nations, and only 10% of these assessments have adequately included persons with disabilities. Now, if these assessments are the first step towards the design of the response, we are faced with a problem, and we need to address that problem very quickly because these response and recovery plans are being designed right now. And although we have clear messages from the top, we have a Secretary General, the UN Secretary General message saying that the response needs to be disability inclusive. We have done something similar in the ILO context. Colleagues in the field, and I mean with that governments, UN officials that are involved in these processes are overloaded with a lot of requests to include gender, to include human rights and this and that. And there's a huge risk that persons with disabilities are overlooked in that. To address that, what we have been doing in collaboration with other UN entities, we have been designing checklists on how to make a socioeconomic response and recovery disability inclusive. And in that context, having disability disaggregated data is fundamental, not only to assess the situation, but also to be able to monitor. I was very interested in hearing some of the comments from colleagues from Kenya. But we need to have these disability disaggregated statistics to really see whether these response plans, when they address employment, when they address social protection, whether they include or not persons with disabilities. If we don't have these data, we will not be able to ensure that people with disabilities are part of the solution and are not left behind. No? So that is our challenge. I think it's very important that we have, if needed, to do this disability-specific surveys, like the colleague from Kenya just mentioned. It's important. Still, sometimes we have to show that people with disabilities are particularly impacted by the crisis. But I think it's even more important to make sure that initiatives like from the Bureaus of Statistics that are doing mainstream surveys among the whole population on the impact of COVID-19, it's there where we have to change. We need to ensure that in these regular surveys that will be undertaken now, that we have included the Washington Group short set of questions to really be able to make the point about whether or not these response plans are addressing persons with disabilities. Tiziana, I think I leave it there so you have time enough for more questions. Thank you.
Thank you very much. Stephan, really useful. I actually want to thank all of our panelists for their very insightful contribution. And I am now passing on to my colleague, Katherine Newton from EDF, who will take over for the question and answer session. Thank you, Katherine.
Thank you very much, Tiziana, also for making my job at this part very easy by keeping everyone to time. And I think it was really, I really always enjoy when when all of you have a very short period of time, the information is really dense and really important. And I think so far we've had the perspective of DFID, of a donor, of national governments, of the United Nations and of disabled persons organizations on how important data is to advocate for inclusion and to advocate for leaving no one behind. So I have the opportunity now to ask some questions to some of our speakers. And I wanted to start, if that's okay, with a direct question actually to Dr. Ashrafi Ahmed. Don't know if you're happy, Dr. Ahmed, to put back on your camera if you like. We would be very interested to know what measures have been taken in Bangladesh to ensure meaningful participation of persons with disabilities and their representative organizations in decision making in general. We heard very good example of the particular programs you've been doing at the moment. Do you have anything more to tell us about this meaningful participation and how you do it?
Yes, thank you. Can you hear me? Okay. So what I want to make clear is that our government is very much committed that inclusion is there. And we have the parliamentary standing committees to oversee all our activities. And they have 3 monthly quarterly meeting with us. And there we have, they get the information from grassroots level. And I told you that our program is collecting data from 570 units all over Bangladesh, and people can also register online. So these database even have their mobile numbers and where they live. So we had a very practical example that we could give persons their relief items with getting who need the most, like the most intervention in the most needed areas we could give with our database. And also we have a high level task force at our ministry that has DPOs actively involved there. And I myself personally am very much interactive with DPOs. They have easy access with me, and we are trying our best so their voices are heard. The very essence of SDG is we must hear people who are not in the focus. So our government is totally committed, and you will be happy to know that our Prime Minister's daughter is a Goodwill Ambassador for Autism in South Asia, and she's also advisor to the WHO for mental health. So she is always advising us and monitoring our activities. Thank you.
Thank you very much for this detailed reply. I have one little follow-up question before I move. I want to ask then to our government representative from Kenya something similar. But what do you do? You're in a role very specific, working with the disability community. What do you do to help encourage other parts of government to take the same inclusive approach? Because you have your initiative, which is very much linked with the disability community, aligned to the Convention on the Rights of Persons with Disabilities, but maybe not all parts of government are always fully aware and in line. How do you manage to do that across government?
Cross government, we have in all our, like in COVID, I will give you an example. We have interministerial meetings. So there I always put up my points. So how we can hear the DPO's voice or the persons with disability. And we are always trying to find out newer ways. And I told in my first part that now our challenge is how to make our data more accessible and usable to other ministries and divisions. We are still finding out effective ways. Surely we will be able to do that.
Yes. So you have inter-ministerial meetings and other methodology that you're developing. Yes. Excellent. Thank you very much. So now I wonder, Zachary, from the Kenyan National Bureau of Statistics, could I ask you also, it's really interesting to see, of course, when the Innovation to Inclusion project was developed, we did not know that we would have this COVID-19 pandemic, but you already last year had done quite some detailed work on using the Washington Group questions in the census and in capacity. How are you using the Washington Group questions at the moment and the disaggregated questions at the moment for policy making during the COVID-19 period and in the future? How do you see that developing in the future?
Oh, thank you very much. And we are leveraging on the capacity of using the Washington Group sets of questionnaire, the short questionnaire, in our survey work. For example, when we are looking at the socio-economic impact of COVID, using the set of questionnaire, we have the potential of ensuring that we'll have very, very well targeted interventions. And also I had mentioned that in our other work that we are doing is that to ensure that we also have a module in the surveys, particularly the continuous household surveys that we normally do, so that we could also get up-to-date work information about information to do with the persons with disability. And also to add on, in the committee, we have a disability committee, which is very inclusive. So we disseminate also this information through these committees. And in these committees, we have the National Council for Persons with Disability that has the overall responsibility of dealing with all issues of persons with disability. Thank you.
Thank you very much. Could I ask you then, similar to what I asked our last speaker, how do you manage to mainstream this approach across the full government? So, for example, if there's initiatives on youth employment or initiatives in another sector, how do you bring your approach, the approach that you've used, across government?
Luckily, what we do is that we are mandated to coordinate the national statistical system. This includes now all the ministries, departments, and agencies, and also to build capacity therein. The approach that we are taking also is to ensure that they do have statistical programs. So we have statistical programs or plans, then we consolidate them to a national strategy for the development.
And one question came from our participants asking how the numbers of persons with disabilities can be accessed. Is that information publicly available?
The information
from your
is
census last year.
Yeah, we have the information that it's publicly available. If you go to our website, you'll see the distribution of population by socio-economic characteristics. So there is volume 4. Yeah.
Okay, so maybe what we will do anyway in the write-up that we make of this event, we can include those links because I think people are interested to look. Thank you so much for your answers. Stephan from ILO, I have a question for you as well, very similar. If the checklists which you were referring to are publicly available, if people would be able to access those.
Yes, sure. I think they've now been made available on the relevant UN websites because they're basically also checklists that for UN colleagues. But let me double check. These are public documents. Now, don't ask me exactly now where they are, but they are. Yeah.
That's really helpful. We can include those afterwards as well. Now I have, if it's okay for Salma and for Jane. It was really interesting, I think, for many participants who are also coming from organizations of people with disabilities to see how you have been generating and collecting data about your community, about people with disabilities, and using, as I think Jane mentioned directly, the word you said was using facts, using these hard facts for advocacy. I'd be very interested to know if either of you have worked in the past during a crisis situation gathering data, or if you've got advice for other organizations of people with disabilities or women with disabilities on how they could get started in this kind of work, gathering and using data for advocacy. Salma, I see you already there, so you could start if you like. I need your mic, actually. I think I can see you, but I don't hear you.
Okay. You know that in the COVID-19 situation, we cannot go out of the house. So it was actually difficult for us to collect the data. But at the same time, we have a very good network in social media. Like Facebook.
Very good. Yeah.
Our network is a huge network. It is about 4,000 people is there. So we get a response, immediate response from the persons with disabilities. What is going on? What is the situation is there in the COVID-19 situation?
Yeah.
So, many people were saying that they didn't receive any relief or didn't receive any support, care support, especially because government is providing some supports to the general people, but the persons with disabilities were excluded from that opportunities because they are receiving allowances, monthly allowances, which is very nominal. You can say $8 or $9 per month. So in this situation, we actually wanted the government should take a special plan, special steps for the persons with disabilities. I'm sure they have some plan, which we will see in the future. But I would like to request, because Dr. Ashrafi Ahmed is here, to take actually, according to this situation, take necessary steps for those persons, because they are in a very vulnerable situation. A lot of them has lost their job. Some of them were doing tuitions to execute their daily livings. Those are stopped. Some are doing the daily like hawkers or rickshaw pulling, something daily works that were doing. So those are stopped because they are not, they cannot get out of the house. So the medical, they needed medical support, they needed the medicine, they needed. So they have no cash to allocate for those to, how I say, to.
I understand, to get through this situation.
Yeah, to get through this.
Yeah, and that's
so,
a really good, it's a really good advice. Yeah,
it's we really appeal to the government to take necessary steps for them immediately.
Yeah, that's a really good advice also for DPO, Salma, and how you've used your social media network to find out what was directly happening with people. Jane, do you have some learning from your side that you would like to share on this topic?
Thank you, Catherine. Yes, I have some experiences that I would like to share. Women Challenge to Challenge is a member of United Disabled Persons of Kenya, and this is an umbrella organization of DPOs in Kenya. And through the UDPK, we were able to participate last year to ensure that during the census 2019, the Statistics Bureau is including persons with disabilities, disaggregated data even by gender to show how many women with disabilities are there in Kenya, what is their situation. And the Bureau is also forming a technical committee, and we are members of that technical committee when it starts operationing. And we want to ensure that when demographic data are being collected, they will be fully inclusive of persons with disabilities, so that we continue capturing more data of persons with disabilities and to see whether changes are taking place. As I mentioned earlier, yes, Women Challenge to Challenge was involved in the data collected by Leonard Cheshire in July 2020, and we were able to interview women who gave their experiences. And if you read the report that is being analyzed now, you'll be able to see what women say. Really, they are more affected than any other person, because given their prior situation, where they are more marginalized, they are more isolated, and now we are seeing a more worse situation where we are getting more isolated because of COVID-19. But we want to change the narrative by doing more advocacy and lobbying more to ensure that we are included in every process.
Thank you very much. That's really, really useful, and it reminds me of the importance and the uniqueness of the project that we're in together. It's really nice to see you again, and we're really looking forward to seeing those publications, because what we find with COVID-19 is the situation of people with disabilities everywhere around the world. There are some commonalities, and these issues that you have raised about isolation at home, socioeconomic risks, the usual personal assistance and support that people with disabilities might ordinarily have, which has all been blocked by the pandemic itself and by the measures taken by governments to address it. I was going to ask one last question, if that's okay, to Neil Jackson, if you're still with us from DFID. It was really good for us to hear the commitments that you had made, that have been made during the Global Summit on Disability. And then also we heard from Kenya that the Global Summit commitments, what led to using the Washington Group questions and the National Census and Admin data. Are there other ways in which DFID is trying to get the rest of the donor community on board in this effort? Because it sounds like you're taking a robust disability-specific effort and then mainstreaming effort, including across your data. How do you bring the rest of the donor community along?
Thanks very much. I think that's a really important question, that we are sort of quite active in DFID. One of what we sort of see as a sort of slightly neglected development challenge is the need to sort of support statistic systems and put that at the heart of the sort of national data ecosystem, because that's where you get the trusted data. So one thing we've done is within the Development Assistance Committee, we have sort of helped to sort of set up a new working group amongst donors to understand the challenges of supporting data for development, and the idea is to sort of lessons and to build a community of practice. So learning from how have we done well in the past, what's worked, what hasn't, and try to build momentum. And I think in parallel, this has worked partly in preparation for the World Data Forum. We're interested in sort of working with other donors and a whole range of partners to raise the profile of data, and in particular sort of look at how do we mobilize the resources that are needed to support statistics. So it was those two initiatives really are how we're working together. Thank you.
Thank you so much. And I find it hard to summarize because we had very comprehensive discussion, but for me, the main message that we have coming out, and thanks to the lessons that we're learning due to this Innovation to Inclusion project, is with the Sustainable Development Goals and the agenda, the 2030 Agenda for Sustainable Development, the world promised to leave no one behind. And it's not possible to leave no one behind unless we count who is included and we find out who's not included. And we've seen here the importance of disaggregated data, but also very importantly from our point of view, the idea that organizations of persons with disabilities are directly involved in collecting, analyzing and using data for advocacy so that it is empowerment, the information is empowerment. And we're very committed to continuing to work along this route, also in the COVID-19 recovery and what comes after, as Stephan mentioned from ILO, the super important socioeconomic recovery which needs to take place, which should also leave no one behind. I would like to thank you all of our speakers, especially for being so coming straight to the point with your short and perfect, precise interventions and responses to questions. Thanking Gerdinand and Lisa, our sign interpreters, and also our captioner, and our organisers for the event today, and our project partners, Leonard, Cheshire. Thank you very much, everyone, for your participation as well, all of participants.
Thank you.
Thank you.
Thank you, everyone.
Thank you. Bye-bye.
Bye.
Bye-bye.